So,
Great.
yeah,
Sorry, handing it over to you, JP, and to Florencia as our co-host. Thank you for hosting today. Over to you.
yeah, thank you, thank you for all the preparation. So yes, I mean, welcome to everybody to this session, and that we are kind of very excited to have this discussion about the portfolio approaches to global challenge. I mean, in this perspective of the future of evaluation, I mean, we will like as an outcome of this session to have some clarity about what is the specifically the particularities of the portfolio evaluation and distinguish that from the single intervention evaluation. But also, I mean, just to understand and explore how the different evaluation functions are working in the different organizations, how that could contribute um, um, to kind of generating the evidence on the global health world, and that's, as I'm sure you are totally aware, is kind of in the middle of big changes on the kind of all these uh, external shocks that are happening at this point. So I'm Juan Pablo Gutierrez. I'm here as a chair of the independent evaluation panel at the Global Fund. I'm moderating this session together with Florencia Ersavis, that she's also a member of the panel. And just to, I mean, quickly mention that the independent evaluation panel is part of this new, I mean, relatively new evaluation function at the Global Fund that has been established to ensure, I mean, that's kind of the mandate to ensure that evaluations are relevant, timely, and high quality. And this function is kind of was built having together kind of the evaluation and learning office that is in this in the established in the office of the executive director of the Global Fund and with the independent evaluation panel. So the body that independent to the secretariat, and we are accountable to the Global Fund board. So we work together with the evaluation and learning office, and the chief of that office is John Group, that is here. He will be participating in this panel. So what's the idea? I mean, we are this session trying to unpack what portfolio evaluation means in practice in different contexts and how it can help to deal with complexity, diversity, and the political nuances of today's challenge, as I mentioned. The common factor here is that we are discussing organizations. And just in a second, we'll introduce our panelists, organizations that are aiming to generate impact by directing resources toward a set of interventions that are carried out by a third party. So in other words, the intervention here, I mean, these portfolios involves allocating funds to achieve a predefined goal. Investment in development, therefore, integrated the portfolio of these organizations, although the definition of what's a portfolio could be different for the different organizations. This discussion includes how the decision to process, I mean, how those funds are invested. In these sessions, in this session, we want to focus on the evaluation of the portfolios rather than discuss how those resources are used, but more kind of how we are in the different organizations doing that process of evaluating the portfolios. So we have for this panel, as it was mentioned on the announcement before. I mean, this is a stellar panel. We have Andrea Acevedo. She's Associate Director for Strategy and Impact in the Open Society Foundations. We have Dugan Fraser, he's the project manager at the Global Evaluation Initiative. And as I said before, we have John Group. He is the Chief Evaluation and Learning Officer for the Global Fund to fight AIDS, tuberculosis, and malaria. So, as I said, three different organizations with kind of common approach in terms of invested in development, but with different internal arguments. So with that, we are going to start with this discussion. And I think that we, as I said earlier, no? I mean, we are talking about portfolio evaluation, but portfolio could mean different things for the different organizations. So we can start with that. I mean, that grounding. I mean, what and to our panelists. I mean, we would like to hear from you. What does portfolio mean in your context for your organization, and how does portfolio level evaluation is different from single intervention evaluation in practice? And we can start with Andrea.
Great. Thank you very much, everybody, for the invitation and for this opportunity. I come very humbly from a very different sector, and I hope I can contribute to the conversation today. So this is a very interesting question for us at OSF, at the Open Society Foundations, because what we consider as a portfolio has been evolving in the last 3 to 4 years in response to how OSF thinks and does strategy. So that change is very much connected to the way that we think how we design our strategic work. So recently, I will talk a little bit more about that, but very recently we moved from a more traditional way of organizing ourselves and understanding a portfolio as a set of grants working more or less on similar issues under a broad set of either thematic or geographic goals towards a more systemic understanding of how change happens, right? Like where our goals, they are focused in certain aspects of a system we believe needs to change. So in practice, it meant for us looking with more attention to what is the right combination of partners that we bring to the table, like what actors you need in a given system to bring us the change we ambition as a foundation. So our portfolios in that perspective today, they have this configuration where you have different actors pursuing different outcomes, but all of them contributing to a final goal that at the end of the day should represent more than the sum of its parts, right? So if you look at an actor alone, you wouldn't be able to understand like the achievement that we're looking as an organization. So I don't want to brush over the fact that there is a very important conversation about legitimacy, about who and how philanthropy, which is the organization that I represent, decides who to bring on board to form this idea about what change we should pursue. But overall, this change in strategy design is directly affecting the way that we think and that we do evaluations at OSF.
Thank you. So very interesting. That's kind of this configuration toward the final goal. That's a kind of approach to portfolio. So Dugan, what's kind of the global evaluation initiative? What's the kind of portfolio definition there?
Hello, JP, and thank you so much for having me on the call. I hope you can hear me clearly. I just want to explain my program briefly, and your question is very valid because I'm busy having an external evaluation done at the moment. So I am the manager of an intervention called the Global Evaluation Initiative. We're a program run out of the World Bank's Independent Evaluation Group. We are supported by a consortium of 12 donors, and the program is co-chaired by the head of the Independent Evaluation Office at UNDP. So we're very conventional, we're very establishment And what we seek to do is to strengthen country monitoring and evaluation systems. Our focus tends to be on evaluation systems, given that monitoring is often basically public management and it's very writ large. And our strategy involves basically working with a network of implementing partners, and that is probably my first portfolio, is the partners that we finance using the resources we get from donors. And those implementing partners are the CLEAR centers, centers for learning on evaluation and results. There are 6 of them. There's one in Lahore in Pakistan, one in Delhi in India, one in Johannesburg in South Africa, one in Dakar in Senegal, one in Sao Paulo in Brazil, and one in Santiago de Chile in Chile. So the Chile one works in Spanish, the Sao Paulo one works in Portuguese, the Anglophone Africa one in Johannesburg speaks English, the Dakar one works in French, and the 2 Indian and Pakistani centers both principally work in English, but also Hindi and Urdu and whatever languages they need to at the local level. So supporting that group of partners is one portfolio for me. I also have a second set of partners that I work with, and they include the Better Evaluation website, which we now actually wholly own and run out of the GEI, as well as the IPDET program based at the University of Bern, which we finance and support. So my first portfolio is the 6 CLEARs, IPDET, Better Evaluation, and we run the Global Evaluation Week. We also work closely with a Canadian university called AMAP. But those are a mechanism to get to my real portfolio, which is the countries where we work. And we have 23 countries we focus on. So each CLEAR has a little portfolio of countries. And when we talk about portfolios, really, I think for my donors, what they want to see is changes in the evaluation systems in those 23 countries. And I'll talk with you more about what that means and how we go about it. But essentially, one of the major questions that I get asked by my donors is, how do you know when a national evaluation system is stronger? Is it because there are an increase in the number of evaluations being done? Is it when you start to see policy decisions being made that reflect evidence that arose from evaluations? Or is it something different? Personally, for me, I'm not a big fan of the evidence agenda as the sole reason for doing evaluations. I think evaluations do more than just produce evidence. I think they're a form of institutional fitness, and they manage to make organizations strong by building an understanding of what it is that they do. But when we talk about portfolios, that's what I'm talking about. Back to you, JP.
Thank you, Logan. So yeah, interesting. I mean, the centers and the countries as the portfolio. Yeah, that's it. And finally, John, I mean, from the global fund perspective, what we are talking when we are talking about portfolios.
Yeah, thanks, JP, and thanks again for this panel, and great to see everyone. And I'm happy to see we've got some good attendance. Yeah, for us, I mean, the Global Fund, for those who don't know, we're focused on HIV, malaria, TB, and health system strengthening, and also recently in the last few years, quite some investment in the C-19 response and pandemic preparedness. The organization itself has been around for about 20 years, originally set up in the early days of the HIV response, but also TB and malaria. And we're working in about 100 countries, and primarily we're a financing mechanism. And so the way it works is it's quite a unique model where countries put in a proposal based on an allocation that's quantified through the strategy committee and through the board in terms of how much funding they can apply for across these different areas. And so it's a very much a bottom-up sort of country responsive sort of model that's quite unique. And then if you think about that coming through as a request for funding, it comes through in terms of those vertical kind of disease areas where they have goals they want to achieve against reduction of incidence and the like. But at the same time, recognition that you can't do that without all of the transversal pieces that will enable your ability to expand services in those areas and achieve the goals. And so if you think of our strategy as a cross between somewhat kind of high-level vertical goals that are disease-oriented, but then also contributing goals and objectives that are across a lot of these transversal issues or levers that need to be accentuated, emphasized to be able to enable those health goals to be achieved. And so an example of that would be the extent to which we're engaging the community in that process of health services, and also in the process of getting access to those resources. The extent to which human rights barriers, obstacles, or facilitators are in place to enable people to avail themselves of services. And so you can pretty easily portfolioize what that looks like, because you've got this cross between the vertical goals and these contributing goals, and there's all these interesting issues in the middle. And so we have a 6-year strategy with two 3-year funding cycles within that 6-year strategy. We have a board-approved evaluation calendar, which is a mix of thematic area evaluations, cyclical kinds of evaluations like strategy reviews, and other kinds of topical areas. And so, for example, right now we're looking at our community engagement work very deeply, our community resilience and system strengthening work very deeply. But we've also just done an evaluation of the malaria portfolio specific to subnational tailoring and subnational engagement and programming of malaria interventions. So for us, it's all a portfolio, because none of the work is done in the absence of these other investments and the other levers. So wherever you look and wherever we turn, it's a portfolio-based approach. And then I think the last thing I would say is it's not just the Global Fund resources on the ground. It's the results at country level are generated collectively by all of the actors who are engaged in the response and those different sectors. And so that also enables us, well, we haven't availed of it enough, but enables us to also work with other partners across like issues. So I'll stop there.
Thank you.
Thank you.
Yeah. So moving, yeah, hand it over to Flor.
I'll just take it and start. And I think in this first block of subsequent block of conversation, we want to talk about what does it look like to commission evaluation at portfolio level. And I wanted to start with Andrea and ask her about navigating this tension, right, that sometimes emerges between working out across very diverse politically, culturally, sometimes thematically, and even approach type contexts, and yet also having to consider how does this inform global decision making. So how do we balance that from the get-go? So Andrea, what are you learning about commissioning evaluations at portfolio level as you transition an OSF transition? I mean, defining purposes, TORs, sourcing evaluators. What does that look like? What would you like to share?
Great. Thank you very much, Flor. But I will talk a little bit about OSF, and I will also preempt that the reflections that I'm sharing here today come from my experience as an evaluation commissioner, as an evaluation professional at the moment in philanthropy. And we have to say that it is a sector that it doesn't have a tradition in evaluation for many different reasons. And it's also coming from the perspective of an organization that is in the process of developing a more structured organizational approach to evaluation. So the learning points that I'm bringing here today, they're based on 3 years of give it or take of commissioning evaluations at OSF, but as part of this process of developing our thinking around evaluation. So the first thing that I raise is that we had to learn to look at defining the purpose of our evaluations as a dynamic process. So just like what we figured out is just as we were approaching our programming in a more systemic way, we would see changes in context, but we'll also see and need to be ready to engage on internal change processes that would require us to think the purpose and the scope of our evaluations differently, right? As part of the evaluation process. So just to contextualize you, as I said, we had a couple of evaluations between the years of 2022 and 2024 that were caught in the middle of a big organizational change process. For those of you that don't know, the Open Society Foundations is a private philanthropy that has offices in more than 13 countries at the moment, and it is one of the largest human rights funders in the world for more than 40 years now. Open Society always had a very decentralized organizational structures. We had offices in 2020 when I joined the OSF in, I think, more than 20 countries or 30 countries at that point in time. And we had work spread across more than 70 countries on around something between 12 and 14 different themes. So we had thematic work, geographic work, and an intersection of thematic and geographic work. And there was very little strategic alignment around all that in a very decentralized organization, which made conversations about evaluation and learning very atomized. And a couple of years ago, our board made the decision of bringing more strategic and more operational coherence for the organization. And for that, they approved a new model of work where our strategy would need to balance global agendas that were of interest for the organization, so human rights and also the themes of democracy, which were also always very dear to us as an organization, with localization, with adaptation of these global themes to the local context and in a very time-bounded way. So we moved from a structure of portfolio where we had open-ended thematic and geographic portfolios to time-bound, more focused, both geographically and thematic work. But the problem was it took us almost 2 years to have clarity on what those priorities would be and what those countries would be for our work. And we had 2 evaluations going on in that process. So during that period, my role as an evaluation commissioner was to keep an ear on the ground organizationally to what would be useful for the different internal stakeholders to ensure that the evaluation was relevant despite the changes that we were going through. So a lot of it was keeping an eye on the big picture of like what we were trying to address with these new portfolios, with this new way of thinking the work, where we had a big picture across different areas. And we had to zoom in and zoom out of certain evaluation questions in a way to create space for us to learn in a way that it wouldn't be possible, we think, if we had evaluations very focused on specific interventions. So for us, that element of the portfolio created a space to be more flexible and to be more responsive to the organizational needs that were changing in a time of transition. And a second thing that we learned as a consequence was that our terms of reference, of course, our contracting process needed to be different. It had to create space for that responsiveness, right? And I know that it's easier for us as a philanthropy. Like I worked at the UN before. I know that is a different conversation if you're talking about the United Nations. But still, like we had many questions that are not necessarily new in contracting, but that were still relevant here. Like how do you work with your finance and your legal team to create a framework for the contractor that is still flexible enough for us to be able to make these adjustments with the evaluation team that we bring in to develop this work, and in a timely manner and in a way that it's not burden for the contracting team and for the evaluation team. Another question for us is how we bring together terms of reference that have embedded that element of flexibility, but that also keep an eye on inclusivity. So how we build this structure in a way where not only big firms can bid to do a project like that. So how do we build this in a way where a smaller company that is on the ground where the impact is happening can feel confident that even in a context where changes might happen, you're dealing with uncertainty, you can know that the contract will have your back. We won't be asking too much, and we will give them the conditions to navigate that contract well. And the same thing is true for, and maybe like in the interest of time, this is the last point. I had an extra point, but this is the last point that I will make. And the same thing is true for the methodological pivots you have to make when you are in a situation like this. As I'm describing, I'm focusing more on the internal changes aspect, right? So at this point, in relation to the methodological pivots, our main question was, what do we see as the role of the evaluator when you're commissioning evaluation in a context of uncertainty like this? And what we learned was that rather than looking for evaluators who saw their roles as guardians of a certain method or of a certain approach, we needed evaluators that saw themselves as problem solvers, as capable of leading these methodological pivots in response to the challenges that were surfacing, while also preserving the integrity of the evaluation exercise. And of course, that led us to how we select these evaluations. Like, where do we find those professionals? And yeah, and in that sense, looking for skills of navigating complexity, of being savvy politically to navigate the political context where they were inserted, was something that was as important as technical skills in terms of looking for the team that you would like to put together. So yeah, this is a little bit of how we have been navigating it.
Lots of food for thought there. I wanted to add another angle to the commissioner role of evaluation and bring in John to talk about how he's been managing such diverse expectations in the context of the Global Fund about what is quality, what do we value in an evaluation amongst different global and local stakeholders, different types of first approaches to evaluation that he needs to engage. And so at the other end of the evaluation, from the commissioning to the quality issue.
Well, Florencia, as you know, it's all very straightforward and simple. But now I would say, I mean, I guess a few things. One, so we know what our values are. I mean, at least the initial sort of valuing process is done through the strategy and through the topics that the board would like us to pursue. And so that's the first cut at the values. And so if you look at the Global Fund, there's a huge value around what I described as the strategy, but also all of these levers that are so important for moving the system forward. And so we have that first step that we can rely on as a kind of North Star, although certainly the context now is changing quite a bit, although the strategy is remaining in place. The resource base and the collective results at country level is likely to change given the shifts we see in global health. But I think for me, the place and the way to really test that in the evaluation process is in going back to the sort of 1978 first version of utilization focused evaluation, where Michael Quinn Patton laid out these different categories of use. And so we've been very much pushing a utilization focused way of working at the Global Fund. But if you recall, those categories are around instrumental use. So is there direct action you can take on findings? There's the conceptual use piece by using the process to help shape understanding. There's the symbolic or political use, I know everyone has read all of this stuff, but I think it's good to bring it back out once in a while. So using evaluation to justify your decisions and to gain legitimacy around things. And finally, process use, the learning and change that occurs through the act of participating in the evaluation itself. And I think those uses really stand up very, very well in a portfolio kind of approach because, for example, you may be looking at a disease area specifically, but you know that a huge piece of the success in that disease area is around data systems, for example, or is around health systems strengthening, or is around surveillance, disease surveillance and laboratory performance and things like that. And so what we do is to pull together two structures to be able to have this conversation. One is what we call a user group. And this is largely the internal group of internal stakeholders who have some relationship to the topic that the TOR is driving at. So, for example, if it's around malaria, you have not just the disease specialists in the room, but you have the people focusing on the workforce, you have the people who are focusing on designing the funding to ensure that the data systems are there. And so we pull from across the organization, across the secretariat, to this interdisciplinary user group to engage on each one of the evaluations. And so there we can look at the different types of use. We can look at, what are the facts and findings that are coming out instrumentally, but then we can also use that process to help align even within the organization where there's some different gaps of understanding and new ways of taking up recommendations. We need to look and see, how effective that is at accomplishing some of these higher order dreams and goals that I have for it. But we find it to be quite efficient, and also to be people are now, if they find out they're not involved, obviously they want to be involved, but we also have people who want to make sure that they're in that user group so that they're taking advantage of the process. The second one that we've only done once, but we will do it again for a large multi-sectoral evaluation that we hope to do in 2026, and that's an external consultation group. So this is where we're going beyond the user group, beyond the people in the secretariat, our sort of investment managers and country managers, and going out to those partners in the broader sector who are also contributing funding and activities around those same things. And so that's a much lighter touch than the user group, but it is a way to get people focused specifically on, are the questions appropriate, but more importantly, where are the relevant places for the findings and recommendations to land in the sector, so they can be most useful. I think the only other thing would be, as a commissioner, is being really careful about not over-promising to your kind of business units and stakeholders, where it's really quite easy in a fun discussion to go around and ask everybody what they want to learn. It's a different discussion when then you have to go back and say, well, actually, of the 95 things you want to learn, we have resources and bandwidth and relevance to do 5, right? And so you have to be able to, in that portfolio kind of discussion, refocus around what's really the most critical set of questions. So those are my thoughts.
Thank you. Super practical and useful things. And I just wanted to invite Doug to chime in, and mainly the provocation is, most of us, I think, often come from and talk about intervention evaluation rather than portfolio evaluation commissioning. So I wanted to invite you to reflect about what's different. What does it look? What are you hearing in this conversation, but beyond? Given that you have such privileged view of the field about this transition.
Thanks, Florencia. I know that we've got a lot to cover, so I'm going to try and keep my contribution quite short. And I think when you're doing a portfolio evaluation, the temptation is to be super colonial. Do you know what I mean? Like to set up a framework, to extract the data from the various components, and then centralize the analysis and make your knowledge based on what's going on wherever you are as a commissioner. And I think what has to be different is a power dynamic. There needs to be a change in the relationship between the people who are being evaluated and the evaluator and their commissioner. And I think what needs to be really different is an understanding of how voice and agency operate, and really what that means for somebody like me who comes from a developing country, who seeks to build capacity, is to be very clear on how you're going to make sure that people who are participating in portfolio evaluations are not subjects. They're not being treated as a resource from which you are extracting, but you're able to give them the necessary knowledge, skills, and capacities that they require in order to participate in these processes as partners. Not only in the process of doing the evaluation, but the prior process in shaping the key evaluation questions, in determining what the data is going to look like. And later, as John is saying, when you get to the use stage, when you're stewarding that evidence in a way that doesn't only benefit the commissioner at the center, but also has an acute understanding of how power functions and what's going on wherever you took that information from. And so what we really need to be thinking about is how power operates in portfolio evaluations, and how we treat these as networked entities that are spider webs of concern, rather than thinking of them as hierarchies that approach evaluation as a resource extraction exercise. Now, how you do that, long term.
That was my question. So exactly, but on what you are working with the Clear Centers and IPDNet, and even in the conversation in this week, right? What are your cues, your principles, or tips, whatever you want to share about those conversations in countries as well?
Yeah, so I mean, I can describe how the GEI approaches this, and we sort of have a framing which looks at 3 levels of work. We firstly start by thinking about the individual. How does an individual's capacities look? We think about institutions and how those institutions work and how they relate to one another. And then we look at the broader context. We look at the evaluation environment and how that climate is, and what the environment does from an authorizing and enabling and empowering perspective. And so what we seek to do through the work we do is we want to build individual capacities, which is the role of the IPDET program. We want to build institutional and the environment, which is the work of the CLEARs. And we base this on an assessment of evaluation systems at a country level, which we call the MISA, the Monitoring and Evaluation Systems Analysis. And we use that in conjunction with a DEVAL tool, DEVAL being the German Development Evaluation Institute. Their tool is called INSEE. It's a more collaborative and participatory tool. Ours is more technical and analytical, but it gives you a sense of what's going on in the country. The danger for us is that we disappear into analysis paralysis, and what is intended as a study to support action becomes a study in and of itself. And that's really a problem for us. But having understood the system, and a lot of the issue here is around the political context, what's going on in that country at the moment, because the one thing we know for sure is that the appetite, the demand for evidence is highly politically contingent. It's not a left-wing thing. It's not a right-wing thing. It's very dependent on what's going on in that place at that time. The window's open when people are interested in hearing about evaluation. They want to know about evidence. They want to have a conversation about policymaking, but windows close and the situation changes, and one needs to be able to respond at the time when you're going to get the biggest bang for your buck. A key factor for us is also leadership. When you get public servants who are fabulous, who are leaders and dynamic and inspiring and creative. We've been working with this woman in Tanzania called Sakina, who's just like a total inspiration. There are lots of those people out there. But it has a lot to do with the political context and the dynamics that are going on there. Our intervention model has got like 3 legs to it. We understand the main issue to be about essentially technical advisory support. So kind of doing policy advice, guidance on how processes should look, what evaluation standards, ethics, what those things look like. We have a big concern with training. Obviously, we do training through the IPDET program, but the CLEARs also do training, a lot of basic training. And I'll say one thing that's happened over the last few years is there's much less demand for basic training. People don't want introduction to M&E. They actually want more sophisticated content and more specialized content focused on their sector, perhaps focused on a particular piece of their intervention. And then a third area of our work is on knowledge sharing and knowledge exchange. That's what we do through the Better Evaluation platform. And what we are finding is that really, we have to work in collaboration with others. This is not a job that can be done either by somebody outside on their own. So you can't come into a country and think you're going to change the system. You're really kidding yourself if that's your approach. But also there needs to be participation and support within people, amongst people within countries. So really building evaluation systems is a team sport, and it's a highly contingent sport on what's going on politically. And those moments pass. When the moment is good, you have to work hard. But ultimately, really what this is essentially about is linking it into a national process. Now, I was on a local webinar earlier this week, and Michael Quinn Patton said to me that he thinks the problem, I know you were there, Florencia. Michael Quinn Patton said to me he thought the problem is the nation state. We need to get beyond the nation state, and we need to be looking at these transboundary interventions. And, you know, I get that, but I also really don't think that's a realistic take. I think that we have to be building on what's in front of us. And countries are how we as a species have decided to function. So, yeah, I can acknowledge that nation states are problematic, but nevertheless, they are what we work with, and we're going to continue to work with them. I hope I answered your question.
That was great. Lots of food for thought. And I'm just curious to hear from Andrea's entry point, which is different than yours, how she deals with evolving global interest in new approaches, new methods, cross-national issues, and still local capacity, local interest, local power dynamics in her role.
Yeah, thanks, Flor. I think this is a very interesting conversation, a very something that we have been thinking a lot at OSF because of this new way of thinking internally, new way internally at least. I'm not saying that we are inventing the wheel here in terms of how we're thinking this strategy, but thinking from an evaluation capacity perspective, like I lost count of times in philanthropy where people reached out to me as someone that comes from Brazil, that is not the usual face and people that you see in global philanthropy from the global north. How many times people reach out to say like, oh, can you find me an evaluator from the global south that like will talk like a PR firm from the US and that is expert in 7 different methods and can do this job in a month for $10,000. And that, I think, ignites a very lively conversation with our country teams and with other people in philanthropy about what is our role in engaging with these capacities. Not only from a self-interest perspective of like we want to find good evaluators that can deal with the complex themes that we engage with, like human rights, like climate change, like democracy, but also what are we building? How are we as philanthropy contributing to build this evaluation ecosystem that Dagan is talking about? Like, what is the role that we as philanthropy can play to make sure that there is national capacities that can help a healthy information environment in that given country where we have programming, where our programming interacts with policy discussions, where our programming interacts with civil society, and how civil society in that particular country is engaging, talking, prepared or not prepared to do evaluation. So we see, at least my team sees evaluation as in the issue of stronger organizations through evaluation and the issue of policy informed processes and approaches as contributing to our goals as an organization. So we ask ourselves how we can contribute to this healthier, and I think to a very important point that Dagan raised, how we can contribute as well to more politically engaged evaluation ecosystems that are not positioning themselves as a way as a step further or a step before the political questions that we are engaging with when we are asking who is producing the data, who is analyzing, who is using it, as Dagan was saying, like thinking it from a power perspective and bringing it very lively and centered in our conversations.
Thank you. I think probably because of time, it's better I'll pass it to JP and we ask John to go from there. Does that make sense?
Yeah, thank you, Flor. So, yeah, I mean, as John, the new function on the global fund is evolving, and I mean, in terms of course, the quality and of the portfolio evaluations, and I mean, but at the same time, it's evolving in the sense that it's maturing in these few years into the process. But I mean, what are the learnings about the kind of end-to-end quality of the portfolio evaluations in terms of ensuring credibility and usability? But in particular, I'm thinking on how the global health ecosystem is evolving at this point, how this role is evolving, how to ensure that credibility and usability of the portfolio level evaluations.
Yeah, I mean, I'll say a few things. Thanks, JP. I'll say a few things about the broader context and then go into, I think, what we're learning, and some of it's related. I mean, on the broader context, obviously the partnership landscape is shifting, the funding landscape is shifting. Governments are putting funding into other areas other than global health. Some are doing that quite dramatically, and others are doing it more incrementally. But it does have an impact on those traditional sources of data and information that we've been relying on for decades and decades. And so it's quite variable across countries that have been receiving donor funds, the extent to which they've been institutionalizing things like demographic and health survey conduct, or things like computer-based patient monitoring systems and those kinds of things. And a lot of the data that the global health sector relies upon comes from those big sources to be able to, set up KPIs or to set up big goals and track against them, to be able to have insight into what's happening at population level and population-based surveys and those kinds of things. And to the extent that those things are reduced or disappear, then that really raises the need and potentially the utility and relevance of evaluation, and specifically portfolio evaluations that are more targeted, that can provide us a lot of information around implementation and what's working and what isn't. And so I think we need to continue to make that argument. If we have control over certain things and not others, certainly from the organizational perspective or the global health ecosystem perspective, evaluation plays a really important role in being able to do targeted evaluations around certain portfolios remains very important, certainly in the absence of some of these other information and data sources that are currently at risk. And so that's sort of the context we're finding ourselves in now. And of course, important to argue then what are the most relevant evaluations that we need to put forward in the current context. But reflecting more on the sort of learning from the setup of the function, I mean, I think there's a lot of learning there. I mean, one is the marketplace, and Andrea spoke to this a bit as well. We really need to keep figuring out ways to reduce the barriers to entry, to be able to work with local regional institutions and individuals, to be able to engage with large operations like ourselves. And so it's not a capacity issue. It's a lost in translation issue in terms of being able to not necessarily purely language sometimes, but also how do we work with these big, conglomerate organizations. So we've been putting a lot of effort into that when we do our sourcing, trying to reach out to more and more institutions, doing more sort of preparation webinars and things like that, so people learn about the Global Fund before they make their application. I think a few other things. I mentioned the engagement work that we've been doing. We've learned a lot around that. It's really important also to have, sort of be able to separate those things that are principles versus those things that are funded. So, people are always saying, well, you need to evaluate sustainability, or you need to evaluate integrated services. And those are things that don't always have a budget line or a central owner in any of these large institutions. And so what we're learning is needing to pull partners together to be able to find that ownership. And then in some cases, a sort of desk review is not enough. You really have to be able to go out and see what's happening at country level. So we have to balance that now in how we're staging our evaluations in the current climate. The last thing I'll say is it's really important to have a kind of North Star quality assurance framework, which we have as our function. IEP and ELO jointly have a quality assurance framework that's on our website. And we're all using the same song sheet now, I would say, to do evaluations and to work with our partners who are conducting the primary data collection to design towards higher quality. So those are some things that I think we've learned, and also can serve addressing gaps in the ecosystem at the same time.
Thank you, Jan. Dugan, I was just thinking on this issue about the marketplace for evaluation, and I mean, what from the kind of the clear centers and the role that the AI have. What's your perspective on that, and in particular, I mean, the capacity to do portfolio evaluations?
Oh, John knows that I've been working for years to try and get a database together of evaluation consultants, but the issue is that there's so many. It's a very complex task, and essentially at core, it requires a capacity to maintain it that I just can't afford at the moment. And I don't think that's an isolated problem. I honestly feel like there's, and I was shaking my head when John was talking, because I think that there's a global evaluation infrastructure that is missing. And really that relates to a number of very boring things that nobody wants to put money or time into, but without which the sector cannot grow, and it will never really become what it needs to be. And I'm talking particularly around things like competency frameworks, accreditation frameworks, agreement on sort of how procurement and sourcing can work differently, things like a global evaluator database. There are a number of databases of evaluations, but what we did is we for example, did a study on existing procurement, and there are a number of platforms, some of them paid, some of them run very focused on particular institutions or very particular sectors. And then, of course, there's LinkedIn. And so what we were trying to think about was a way of using LinkedIn as a sort of global platform that we could hook people into. But, the thing about LinkedIn is that it has very poor numbers in the developing world. It's essentially a global north thing. So none of these things are going to solve the problems without some investment. And the challenge is kind of inspiring people to see the value of this kind of stuff. So yes, I run a training program at the University of Bern, and it's fabulous, and everybody loves it, and it's really great. But there isn't a micro-credentialing scheme that allows you to stack up your, let's say you do a day-long workshop, or you do a week thing, or I don't know, you do a research project. But if you're a public servant working in a developing country government and you want to grow as a professional and you seek a career path, it's very difficult to proceed as an evaluator. And generally, you'll end up having to get promoted out of your area of expertise, you know, the Peter principle, where you good at your job, so they make you do something else, you know what I mean? But I do feel like there's a growing interest in these boring elements of the global evaluation system. And I'm kind of hoping that one of the things that GEI is going to be able to do is to play a bit of a role in convening work around this. But, you know, it's very difficult at this time to mobilize resources for this sort of thing when, you know, people aren't getting their ARVs where I come from. People are struggling to put food on the table. Now, how do you really authentically motivate for this kind of investment in the current context? And I do feel like we missed the boat. I think when times were good and we were swanning around going to conferences all over the world, we should have been using some of that money on other stuff. Oh my gosh, regrets. But nevertheless, I do think, as I say, that there's a kind of climate shift. I'm going to stop talking, but I could waffle on about this for ages. Sorry.
Thank you. No, that's great. I mean, I think that's very great points. I guess we should move to the part of the session that we open the floor for our assistants or participants to ask questions. I don't know how that works in terms of if they are able to speak now. Or...
We are about to make that happen. Thank you, JP.
So, I mean, the floor is open for questions, and of course, I mean, at the same time, each of you, the panelists, could ask questions to the other participants. I don't know if there are any questions from the audience.
Hello.
Gustavo?
Oh, hi. All right. How's everyone? Thank you for this opportunity to be part of this discussion. I think it's extremely relevant given the current circumstances, especially as we probably are expecting to see even more constrained resources. How do you think is the best way to adapt? No, like it's been happening, especially like there are some big participants in the evaluation world that have been directly affected, but it seems like it's going to be even further decrease, no? The funding, whether it's the UK or other countries that are shifting the priorities, as you said, and to them. So how do you think is the best way to adapt to that new reality? Yeah.
Thank you, Gustavo. I don't know who wants to answer that or comment on that. Dugan, go ahead.
I really think we need to adopt a huddle. I think we've got to adopt a very defensive posture. I think we need to connect person to person. I think that the relationships we have are what are going to sustain us. And I think that means like reaching out, actually contacting people you haven't spoken to for a while. But essentially, I think the bottom line is that this is about focusing on country level systems, because this global thing, which arose in the 80s, when I was young and I was studying sociology in Johannesburg, globalization was a prospective idea. It was like something that was coming, and it happened. But what it did is it drove massive inequality and created the conditions that have led to the political context we have today. And I think that really what has to happen is that people need to cut out all the fluff and the guff, and they need to compress these systems and become much more focused on providing information that's needed. And I think that that really is, and I'm not saying this because I think it's what's right, but I think a lot of the global entities, including the one I work for, are going to find themselves in a very much more constrained context. And what that means for us is that we need to be in the places where we're from, and we need to support those people, and we need to work with them. And at the same time, I need to have John Grove on my WhatsApp. And when I'm having a freak out, I need to be able to send John a text message and say, please give me some advice, which he does, and I do. But I really, really think that we have to have this combination of a defensive stance. I think we need to build our connections and strengthen our personal networks. And we need to look at how we make our country strong, because this is unfortunately where we have arrived as a species. And I think it's going to be tough.
Thank you, Dugan. I
Thank
don't
you.
know if either Andrea or John wants to make a comment on that.
Andrea, go ahead. I'll share a couple thoughts.
No, John, you can start.
Yeah, I mean, I think even though you don't want a crisis like these ever, it does push you to reframe. It does push you to prioritize. It does push you to get back to the basics, I think, as Dugan is saying. And I think it also helps to raise the questions again around accountability and ownership, of looking after people in the community, looking after people in society. And so if there's any silver lining in any of this, my dream would be that we reimagine how we do global health, how we do our work, how we give voice and power to more and more at the country level, how we make sure that national institutions are capacitized to do more and more, how to use evaluation to get policymakers to see that this is important. But it's all part of a whole line of other dominoes that have to not fall, right? You have to convince governments to put money into universal health coverage and primary health care and things like that. And so I think for me, it's a matter of, our leaders within our sector in the sort of global health architecture, so-called, to have that reflection moment and have that sort of moment to translate crisis into opportunity. I know it sounds very lofty, but I think that's where we're at. And so hopefully those conversations are going to be happening. But there has to be authenticity in it as well, and moving away from some of these older attitudes that Dugan's mentioned.
Thank you, John. Andrea?
Yeah, I'll just share a quick thought on that I think it will be interesting to see what is the real buy-in, right, in the different countries now that these global elements, the global component is not pushing in, it's not like trying to bring in the agenda. So it will be an interesting challenge to see like what countries will really like lean into it to try to cover gaps or try to understand how this can build from the ground. So Duggan, for you, I imagine it will bring interesting insights. But as I was saying, I think it's also an opportunity to think about what are the role of other actors that are not the international actors in building in these local ecosystems, how we can bring in voices that might not have been present very often in these discussions because they were so internationalized.
Thank you all. I wanted to, before we wrap up, JP wraps up, is to ask you all. I mean, this is an purposively unusual mix of panelists. And I wanted to ask you what stood out from hearing each other? Anything that challenged you or that expanded your thinking? Any ahas from listen? I don't know who wants to start.
You should have given us a heads up you were going to ask this question. We would have been paying more attention and taking notes. I found it very helpful for John to remind me about the Michael Quinn pattern forms of use. I often actually refer back to them, but I find them helpful. And I think that a lot of what I am saying when I push back against the evidence agenda is in fact covered by what Michael Quinn Patton was saying about the different forms of use. I just think that often they're not understood as use. It's not like you're using the evaluation. I think the evaluation is a form of a process or itself. Do you know what I mean? But I also think that essentially we need to return to an understanding of who calls the shots and makes decisions about what gets done in country contexts. And I think Andrea's right, that when countries have to start paying for stuff themselves, we might start to realize that some of the things that they were doing were not really something they saw as a priority. They were doing it because it was being funded. But yeah, I'll stop there.
Super helpful. John, Andrea?
Yeah, I think for me, it's around this idea of systems and national systems and taking a systems view. It's easy to say, we always say, well, we need to take a systems approach, but I do think both Dugan and Andrea touched on that. And both, is there a way to look at this sort of reworking the architecture, or as Dugan says, getting into a huddle around this and seeing what needs to be done and sort of reactivating national evaluation capacity. And Andrea also mentioning this all the way into the national and local levels as well. And what are the sort of contextual things that probably could be tackled better to make some of this work more effectively. So I think for me, that's a key thread from today.
Andrea?
I think, Duggan, do you want to come in?
Yeah, I just wanted to say one thing, in the evaluation community, people talk about systems and they like to treat systems like it's some sort of metaphysical concept, like it's like a current or a sort of wind. It's kind of like a vibe. It's not. It's people and it's processes. And I really, when we talk about a national evaluation system, there are actual things. There are filing cabinets involved. There are buildings with corridors and human beings walking along. That is what the system is. We're not talking about an imaginary thing. So when we talk about systems, let's get real about what we really mean.
Exactly. Yeah, I think I think my point connects exactly to what Duggan was saying. Like, we're talking about national evaluation systems. We're talking about the individual capacity. We're talking about the institutions, and this is something that even for me working with teams that have that very clearly in terms of the way they are working, when you bring this to evaluation and when you ask them what are the relationships, what are the processes that make this system, they look at you like, what are you talking about? And then you have to really break down and and I think the way that you put it, Duggan, was really clear, and I think it's always very helpful to move away from this ethereal image of what systems is, right? So for me, like, this entire conversation and the points that you folks brought were a step towards demystifying this word that has been so abused in this space.
Thank you. Very interesting points. To finalize our discussion, can you just put in one sentence? What could be done to make sure that this portfolio evaluation is contributing to more equitable global action? I mean, what's the shift that has to be done at this point? Of course, take into account kind of all the global challenges that we are all facing on this side. So we can maybe go first with Dugan, then Andrea, and then John.
I think it would be really helpful if when we're doing portfolio evaluation, we're clear on how we're going to use it and who is going to use it. And I think to be very, very specific about how the people who provide data and who are being evaluated contribute and how they get empowered through the exercise. That's what I think needs to happen.
Great. Andrea?
I think we need to rethink our role as evaluators and as commissioners of evaluators to enable the points that Dugan raised at all, and that is in all levels. So as citizens, individually as citizens in societies that are becoming more closed every day, that are less open, as professionals, as we are like doing work while the governance systems that we're trying to change, they are being challenged, right? And as human beings in a planet that is also being put under pressure. So like, how do we rethink our role as change agents in all these aspects?
Great. John?
Yeah, I think there are a number of kind of interdisciplinary, intersectional kinds of issues that we could more proactively build into all of our evaluations. That if you were to then put it through a magical Microsoft Copilot or ChatGPT would spit out all of the answers, right? So these sort of buzzwords like sustainability, capacity, these aren't, I mean, they are buzzwords, but they're real things that everyone is dealing with. Everyone's figuring out how to deal with sustainability. Everyone's dealing with how to do better resource optimization. Everyone's looking at how to make sure, people have access to certain services vis-a-vis human rights barriers and the like. So there's a set of things that just tend to always be the same obstacles. And if we could push for some, dare I say standardization, but some kind of commonality in some of these universal issues that we could all be building in as objectives and key questions on top of the bigger topics, or within the bigger topics, we might be adding more power to the decision-making process of the evidence base. More than a sentence, sorry.
Yeah, but yeah, good points. Flor, did you want to make any final comment?
I just want to thank you for joining. And this week is packed with events and people are rushing amidst everything. But I'm going to make sure that a bunch of people get the recording of this, because I think you raised some really useful points for us to continue grappling with as we move, and some truth that I hope we would hear more of. So thank you for the candidness and the tone, and I really appreciated the conversation.
Yeah, totally. Very useful conversation, and I think that kind of helpful also for us to bring this discussion about the portfolio evaluation. So thank you to you for your inputs and participation, and thank you to all the attendants, assistants to this session.
Thank you all. Thanks also to Rita, who was here.
Yes.
Yeah, thank you
very
Rita.
much.
Thank you to
Thank you,
Rita,
Flo
thanks to
and
Florencia
JP.
and JP.
And thanks to GEI for global.
Yes.
Yeah.
Thanks
Thanks,
everybody.
bye-bye.
Take care.
Bye-bye.
Bye.
Bye.
Bye.